Welcome to NSG 217. Study Session 4. Performing postural drainage. Introduction. Postural drainage is an airway clearance technique that drains secretion from specific lung and bronchi segments into the trachea. It is also called segmented bronchial drainage. This study session will enable you to know about postural drainage, reasons for postural drainage, how to determine the area to be selected for postural drainage, clients who should have postural drainage, as well as clients who cannot have postural drainage. It also includes the articles needed for postural drainage and step-by-step technique. Learning outcomes for study session 4. At the end of this study session, you should be able to 1. Explain the meaning of postural drainage, state the position for draining different areas of the lung, and lastly, state the step-by-step technique of postural drainage. 1. Postural drainage. Postural drainage is the gravitational clearance of secretion from specific bronchial segments by using one or more of 10 different positions. Each position drains a specific corresponding section of the tracheobronchial tree, either from the upper, middle, or lower lung field into the trachea. Coughing or suctioning can then remove the secretions from the trachea. The reasons for postural drainage are as follows. The presence of accumulated secretion can promote bacterial growth, leading to infection. Also, the secretion can obstruct the smaller airway passages and can cause atelectasis. Areas for drainage can be selected based on, as illustrated in the diagram below, chest X-ray examination result, physical assessment of the chest, and knowledge of patient's condition and disease process. What kind of people can have postural drainage? That is, indication. The following are the class of people who can have postural drainage. Number 1, bronchiectasis. Number 2, cystic fibrosis. Number 3, chronic obstructive pulmonary disease, that is COPD. Positions for draining different area of the lung. Number 1, left and right upper lobe anterior apical bronchi. You will have patients sit in a chair leaning back, percusses with cupped hands, and vibrates with heels of hand at shoulders and with fingers over collarbone. Both sides can be done at the same time. Note: body posture and arm position of nurse. Nurse's back is kept straight and elbow and knees are slightly flexed. Number 2, left and right upper lobes posterior apical bronchi. You will have clients sit in a chair leaning forward on pillow or cardiac table. Percuss and vibrate with hands on either side of the upper spine. Can do both sides at the same time. Number 3, right and left anterior upper lobe bronchi. You will have the client lie flat on back with small pillow under knees. Percuss and vibrate just below clavicle on either side of the sternum. Number 4, upper left lobe lingular bronchus. You will have clients lie on the right side with arm overhead in Trendelenburg position with foot of bed raised, that is 30 centimeters. Place pillow behind back and roll patient 1/4 on the pillow. Percuss and vibrate lateral to left nipple below axilla. Number 5, right middle lobe bronchus. You will have client lie on left side, raise foot of bed 30 cm, place pillow behind back and roll patient 1/4 turned on the pillow. Percuss and vibrate area of light nipple below axilla. Number 6, left and right anterior lower lobe bronchi. You will have patient lie on the back in Trendelenburg position with foot of bed elevated 45 to 50 cm. Have knees bent on pillow. Percuss and vibrate over lower anterior ribs on both sides. Number 7, right lower lobe lateral bronchus. You will have client lie on the left in Trendelenburg position with foot of bed raised to 45 to 50 cm. Percuss and vibrate right side of the chest below scapular posterior to mid axillary line. Number 8, left lower lateral bronchus. You will have patient lie on the right side in Trendelenburg position with foot of bed raised to 45 to 50 cm. Percuss and vibrate left side of the chest below scapular posterior to mid axillary line. Number 9, right and left lower lobe bronchi. You will have patient lie flat on stomach with pillow under stomach. Percuss and vibrate below scapulae on either side of spine. Number 10, left and right basal bronchi. You will have patient lie on the stomach with Trendelenburg position with foot of bed elevated 40 to 50 cm. Percuss and vibrate over posterior ribs on either side of the spine. The picture below illustrates different positions for draining different areas of the lungs. Articles needed. Number 1, a comfortable surface that can be slanted, such as hospital beds in Trendelenburg position or tilt table and chair for draining upper lobe areas. Number 2, 1 to 4 pillows depending on patient posture and comfort. Number 3, a glass with water. Number 4, tissues and paper bag. Number 5, sputum cup. The table below shows step-by-step technique of postural drainage and the rationale behind it.